discussing a very important topic, Burkitt's lymphoma. It is one of the very highly aggressive and extranodal beta cell lymphoma. It usually presents in early childhood worldwide. Most common childhood malignancy worldwide. Male to female ratio of this disease is around 3:1. Extranodal, it presents as extranodal involvement or as leukemia. Burkitt's lymphoma is associated with specific chromosomal translocation involving MYC oncogene from chromosome 8, very important, from chromosome 8 to immunoglobulin heavy chain region on chromosome 14. So there are basically three categories of Burkitt's lymphoma. The first one is the endemic variety, which is seen most common in Africa. The sporadic or the non-endemic variety of Burkitt's lymphoma, uh, the immunodeficiency associated HIV lymphoma, so it is most commonly seen in immunodeficiency patients, especially HIV, the third category. So the clinical features of the endemic form are: it affects usually children and adolescents associated with EBV infection. It corresponds to the distribution of malaria, involves extranodal sites like jaw, GIT, and gonads, commonly presents as a rapidly growing jaw tumor in children. Involvement of mandible and maxillary bone leads to deformity, loosening of teeth, and exclusion of eye with loss of vision. So these are the common clinical features of the endemic form of Burkitt's lymphoma. So the sporadic form presents as an abdominal mass. Immunodeficiency associated usually occurs in patients with CD4 counts more than 200. It again usually presents with abdominal involvement. Abdominal involvement usually presents as an abdominal mass due to bilateral involvement of kidneys, ovaries, adrenal glands, bowel, and lymph nodes. Other site of involvement like CNS, long bones, salivary glands, thyroid, testes, heart, breast, and bone marrow. So these are the clinical features of the sporadic and the HIV-induced lymphoma. So coming to the investigations, histology, very important MCQ, will give you starry sky pattern appearance. Chromosomal analysis can be done. Antibodies to Epstein-Barr virus, capsid antigen is positive in some of the cases. So this is a histological picture for Burkitt's lymphoma showing the starry sky appearance. Coming to the management, treatment should be initiated promptly. Adequate hydration before initiation of therapy to prevent tumor lysis syndrome. A CHOP regimen, which consists of cyclophosphamide, hydroxyrubicon, on-COVID, and prednisolone. Rituximab can also be tried. Prophylactic CNS therapy is essential. Intrathecal methotrexate, like into the spinal cord, can be tried. A high cure rates for this disease, which is around 70 to 80% if detected and treated early and treated aggressively.